Hey, good morning. Well, it's morning where I am. I'm not sure exactly what time of day it is when you get an opportunity to join me in this, but I am live. So maybe right now you find your way for us to venture together, or maybe you find that we get to venture together later in your own time because this is about you and your child or any children that you have the opportunity to empower. So, welcome to the Empower Children Overcoming ADHD. What do we call this? It's more than just a video. This is an opportunity for life and life more abundantly. That's why we're here. We're here because I want for you to have true empowerment. I want for your child to have true freedom. I want you to be able to see how obtaining accurate information, then using that to develop, and maybe even for us to work together to help you develop your own plan based on your wisdom, your ingenuity, and belief in yourself can put you on a path to empowering your child or any child that you get to work with transformative opportunities that you can help your child regardless of whatever they may have been diagnosed with, whatever challenges they have, whatever confusing behavior, repeated outcomes, whatever has been baffling, whatever has been troublesome. It is important to note that children can overcome these challenges, that the vast majority of children, and not every child, but almost every child, and far more children than we give the opportunity. When I say we, I'm talking about starting with us as medical professionals. Now, I've had the privilege of being a licensed professional counselor in the state of Arkansas for over 25 years, but I come to you today as a fellow parent and as a guide to empower you with accurate information, then your plan, and then for you to empower your child to overcome the challenges that they have. Now, we're talking about ADHD because this is a very popular concept when it comes to the challenges that a child may have academically, behaviorally, emotionally, socially. And these challenges are often, excuse me, thank you, under the umbrella of ADHD. So let's look at ADHD and we'll continue our journey looking at ADHD from an accurate information standpoint because I believe that when you have accurate information, that can be the basis of being able to make informed decisions. A lot of times the information that we have about ADHD, in fact, most of the information is not based on accuracy when it comes to the actual and only diagnostic criteria for ADHD, not based on science and not based on actual historical accounts. Now, you're going to hear a lot of things where people are going to talk about what constitutes ADHD. That's a diagnostic criteria, or what are historical, well, I would say historical tellings or what happened in history or what people often said or referred to, because a lot about ADHD actually comes from, or in our popular way of doing things or popular culture, really comes from people sharing what something is based on, okay, for example, somebody may have said something a long time ago. One of the most popular accounts from a historical point of view when it comes to ADHD is, okay, yeah, I'm struggling because I didn't actually prepare that fact. So I'm going to get into the history and I'm straying off course. So that's why I'm stumbling around. And I don't want to stray off course because I'm trying to be here to help you be on course. I've got to be on course. So let me stick with the DSM. Okay. So there are so many popular ideas about what ADHD is. And we're starting with looking at it from the actual diagnostic criteria from this book. All right. The DSM for short, the Diagnostic and Statistical Manual of Mental Disorders from the American Psychiatric Association. This is the fifth edition. The most recent edition is the DSM 5 TR, stands for text revision. The reason why I'm using this copy is because, as you can see, this is a big book. And I've got one copy, one physical copy of the DSM, and that's the DSM 5. The DSM 5 TR, the latest edition, I have a digital copy, but that's not going to be very helpful for you to be able to see because I'm not savvy enough yet to be able to share my screen. But what I'm getting at is I want you to be able to see for yourself the accurate information from the DSM. So I'll be reading from the DSM, but also for you to know that what's in the DSM-5 and what's in the DSM-5 TR about ADHD is almost exactly the same. There might be a word here or there that might be different, but it's pretty much the same from the DSM-5 to the DSM-5 TR. So I want you to know that we are striving to be up to date with the latest diagnostic criteria. And when we look at that diagnostic criteria, I want to reference video one, which there's a link in the description below to video one, where we talked about the DSM. And when I talked about the introduction, which we're going to reference again today, I mention often ICD. I kept saying the acronym ICD. Well, the ICD acronym stands for the International Classification of Diseases. And so the World Health Organization is responsible for putting together the ICD, or the International Classification of Diseases. And the American Psychiatric Association has put together the Diagnostic and Statistical Manual of Mental Disorders, the DSM. And so the World Health Organization, who was organizing the International Classification of Diseases, and the leaders from the American Psychiatric Association, who were organizing the DSM, came together to put together, let's just focus on this, to put together the DSM. So every source of diagnosis for any type of mental or behavioral health condition, well, not condition, sorry, let me rephrase that. Anytime you're going to get a diagnosis, it's going to come from the DSM. There's only one source. So when we look at you and any diagnosis you have, this is where it's going to be referenced. We discussed last time in the introduction that the leaders in the American Psychiatric Association and the World Health Organization made it clear. They made it clear in the introduction, which is found in both the DSM-5 and the DSM-5 TR, that ADHD was placed, and these are the words, and let me actually read them again. Let's make sure that when we're looking at accurate information, let me read again from the DSM. Okay. And I'm just going to pick up here because I go into this in more depth in the last video. But picking up in this section in the introduction to the DSM, says, when disparities emerged, they almost always reflected the need to make a judgment about where to place a disorder. So disparities, meaning that as the World Health Organization leaders and the American Psychiatric Association leaders were working together to organize the ICD, International Classification of Diseases, and the DSM, the Diagnostic and Statistical Manual of Mental Disorders, they were often able to agree. But there were times when they weren't able to agree. So this is when disparities emerge. Let's go on to read what they indicate about this. When disparities emerged, they almost always reflected the need to make a judgment about where to place a disorder in the face of incomplete, please hear this, everybody, or more often conflicting data. Thus, for example, on the basis of patterns of symptoms, comorbidity, and shared risk factors, attention deficit hyperactivity disorder, ADHD, was placed with neurodevelopmental disorders. But the same data also supported strong arguments to place to place ADHD within disruptive impulse control and conduct disorders. Again, why is this important? We're recapping this because this is something that's in the medical community we never talk about. We don't share with people. You're not going to hear this on podcasts and other videos or when people are discussing ADHD. We're not going to hear that the leaders in the World Health Organization and the American Psychiatric Association found it important to include basically a disclaimer, basically to be able to present accurate information about how ADHD was placed or connected with a neurodevelopmental disorder. You will often hear ADHD is a neurodevelopmental disorder. And in the neurodevelopmental disorder section of the DSM, it says ADHD is a neurodevelopmental disorder. But we must understand this in context. In context, we understand that the accurate information indicates that ADHD was placed in that category based on incomplete or more often conflicting data, that they had to make a judgment about where to put it because of this. It was not indicated, ADHD is not indicated as a neurodevelopmental disorder based on science, not based on actual historical accounts, not based on an understanding, and with that, a foundational agreement that ADHD actually is a neurodevelopmental disorder. Now, when we say neurodevelopmental disorder, simply put, we're talking about something that is connected with or because of the brain. Simply. Now, this is also important because another common myth that's purported about the DSM is that psychiatric disorders are basically categories of symptoms, which is what the DSM indicates, categories of symptoms, whether it be ADHD, anxiety disorder, major depressive disorder. The common belief that is encouraged from the medical society or maybe society in general or both is that the DSM is indicating many of these as conditions or some type of chemical imbalance or neurological factor or something going on inside our brain or our chemistry, our biochemistry that is basically causing or fueling these conditions. The problem is for most of the disorders indicated in the DSM doesn't indicate that. And I know certain things we're going to discuss today, you may have heard the contrary. And so when I am sharing something, then you may want to just turn this off because whenever we are faced with information that is so contrary to what other people and other sources that we have come to identify with or trust have said, we are now confronted with confirmation bias. And confirmation bias is just that we as humans are confronted with information that's contrary to what we have come to understand and believe. And in those times, we have a tendency to want to reject that information, to turn it off. But here's my challenge for you. My challenge towards your life and love and empowerment is for you to just hear or absorb this information. I'm not asking you to believe it, but I'm asking you to consider something very important. One of the things I want you to consider is where this information is presented from. Is this AJ McMahon, which I may have actually neglected at the beginning of this video to introduce myself, but that's because I'm not the important person here. The important people here are the children. The important people is your child. The important people is you. The important people are those who you get a chance to be able to empower and influence that this and your child and you are so important. That's why we're here. And it's important that you take an opportunity to just absorb this information for yourself, to be able to take into account what are the sources of this information and what are the sources of the information that you have been given before, to be able to discern that. Is this AJ McMahon presenting information, just telling you stuff, which is often what happens? People just tell you stuff. Doctors, teachers, they tell. And that's what often happens when it comes to ADHD and the way that we practice medically. Often what happens is we are told things about what ADHD means. But when we go to actual sources, there can be quite a disparity, such as what they indicated in the introduction when disparities emerge, because there's often great disparities between what we're told, what's popular in beliefs, what's often purported in media and podcasts or by doctors, and what's in the actual criteria and actual historical events and actually related to actual science. Okay. I know I said actual a lot. All right. That's actually a lot of times. Okay. So, what we're trying to do here. So, here's the challenge. I said I was going to do a challenge. My challenge is to just ask you to just take in the information, to try to be able to hear all this out, to examine the sources that they come from, and even do some fact checking of your own. Do some, please. And I really strongly encourage you to do fact checking of your own, because you're not sheep. You are intelligent. In fact, a lot of times your intelligence is diminished because popular belief keeps telling you these things that you are likely going to be able to dismiss things that you have the inkling of understanding, that you have wisdom about, that you may have put aside because it doesn't conform to what you heard so often. And here, we're here to help you unlock your wisdom and your truth and your understanding, because that's the path of empowerment. That's the path of transformation for your child or any children that you get an opportunity to work with or empower or love. So that's why we're here. We're here because of love. And in love, we just get an opportunity to not reject the accuracy of information, but embrace it. So when we look again and understand what the DSM is actually telling us, we have to take ADHD in context, that the leaders in the World Health Organization and the American Psychiatric Association, who put together the DSM, the only source of diagnosis for any person or professional when it comes to ADHD, the leaders are not convinced that ADHD is a neurological, basically connected in any way to the brain. That the same data presented strong arguments to place it in the behavior category, because when we're talking about behavior, they indicated it as such because this has to do with the DSM categorizing challenges that are basically behavioral challenges that are not in any way connected to the brain. So distinguishing that neurodevelopmental has to do with the brain. Behavioral, not brain. This is from the DSM, not AJ McMahon. So the leaders from the World Health Organization and the American Psychiatric Association are trying to help us understand that there's not a foundation of fact that they can draw on to be able to indicate without a doubt that ADHD has anything to do with the brain. So why are we? Here we are to be able to look at ADHD further. And if I have been a bit redundant with this, I hope you understand the passion by which I come from that, because this information and the accuracy of it is so important. How can we be able to move forward in our lives and make wise decisions if we are given narrative but not accurate information? When we're only told part of the story and not the full story. How well do we do at being able to be empowered when information is often not brought to our attention. What's more empowering? Would you rather have limited information, or would you rather have all the information and make your own judgments? Well, that's what I believe is key about accurate information, that we medical professionals or people, that we get a chance to share the accurate information and you make up your own mind. That's why I encourage you to stick with this. That's why I encourage you not to turn this off, no matter how contrary this may seem to what is, excuse me, everything else that's being purported out there about ADHD, that you just take this into account. You fact check it for yourself. You go in and listen carefully and use discernment when it comes to other sources, whether it's podcast or video. Are they presenting actual sources, or are those sources verified? For example, is it something like they're indicating, well, this was shared 80, 90, 100 years ago, and they're telling you about it, and then they're giving an interpretation of what was written or what was said back then? Is that what you're getting? Or are they actually pulling out the source, being able to look at it in context and talk about it in actual context, not the context of the narrative? See, that's the context we're often getting. We're getting the context of the narrative about what ADHD is, not the context of what that writer or that speaker, not the context of possibly that writer or speaker. And for to have an accurate, I mean, how would you want somebody to take something that you wrote or you said and give their own interpretation of it? Or would you want them to take that and try to understand what you meant, where you were coming from? And that's what we're doing when we look at things from an accurate perspective. So we're going to continue with the DSM. And okay, we're gonna go back to the DSM. I was kind of checking how much time we have here, and so let's go back to the DSM. All right, when we talk about ADHD now, understanding when we're looking at the criteria of ADHD from the DSM. First, let me make this clear, that there are medical professionals that are licensed to diagnose from the DSM. That can be a psychologist, it can be a psychiatrist, it can be a social worker, it can be I'm leaving out a professional, licensed professional counselor like myself. And there are others who I'm probably not naming that are licensed. And all those who are trained and licensed have been given and empowered by the medical society to be able to diagnose from the DSM. So the psychiatrist or the medical doctor is often seen as more capable, or because of their license. But across the board, whoever is licensed, so a master's level counselor like myself and a doctor has the same authority to diagnose from the DSM. There's no difference in authority as far as that goes, to diagnose from the DSM. Now, I will say this, and I'm not trying to be mean or funny, but teachers are not licensed, or they are not licensed to diagnose from the DSM. Now, when we're talking about this, it's because it's not trying to say that the teachers out there don't care and aren't trying to help kids, but it's to be able to distinguish those who are empowered to diagnose from DSM and those who are not. And then to be able to even go further, because those of us who are empowered to diagnose from the DSM doesn't always mean that we're doing that from an accurate foundation. And that's just the fact. So I'm not picking on teachers, but I'm really trying to talk about levels of discernment, that One, I say you want to be able to go and when you're looking at any type of diagnosis to a professional that's been licensed and trained to diagnose, to be able to understand that the doctor doesn't have more authority than the master's level counselor as long as they're licensed and trained and diagnosed. Why is this important? Because the real key is not about necessarily the license or credentials or the level of them. The real key is about how that professional, what level of understanding they have of the DSM, of history, of science, and children. And I am telling you, that varies tremendously. Is that professional able to communicate and show you when asked their foundation of information? Or are they telling you what most professionals, regardless of level of licensure, are indicating? And that's from popular belief. Because you would think that in all the education and with all the credentials and all the training that we as medical or mental health professionals go through, you would think that ADHD is something that has very extensive and exhaustive, let's say, teaching uh, that is backed by that. But I'm here to tell you another startling truth that it's often not. That we don't really study ADHD even as a medical field. We pass down that information basically by communicating belief or what's popular theory. So when we look at it, it can sound heretical, but I'm trying to indicate to you that you want to be able to go beyond just a license or somebody who can speak eloquently, unlike what I'm doing today. But you want to be able to try to vet your source a bit more. Okay, where are you getting this information? Can you show me the diagnostic criteria you're using and match that up with the symptomology of my child? What Okay, so you're indicating that this person 80, 90, 100, 200 years ago said this. Can we pull that out and take a look at that in context? You're given an example of a historical account. Can you actually pull up that historical account and let's look at the details of it and really be able to take it in context and try to understand it? You're talking about psychotropic drugs, which is often we call medication for ADHD, but I call it psychotropic drugs. We'll get into that in future videos. But can we talk specifically about what this drug was developed for, how it came into being, how it came from origination to the point that it's being prescribed to my child? So when you look at these sources, I am encouraging you to use discernment and a bit of vetting to be able to listen with your third ear to what's being shared and see if it matches up with wisdom and from sources of accurate information. That's why we're looking at and starting with the DSM, because this is a source of information. Now, it's not the end all and be all, it's just to be able to help us look at and discern what's popular or the narrative from what the DSM actually indicates in general. So, when we look at the diagnostic criteria for ADHD in the DSM, we're not going to go through all of this, but there's a couple of things I want to point out. First, at the beginning of the diagnostic criteria for ADHD, it starts by here indicating that ADHD is a persistent pattern of inattention, and or hyperactivity, impulsivity that interferes with functioning or development. Okay, a persistent pattern of inattention and or hyperactivity, impulsivity. Now, that's what is happening when you are faced with the struggles that your child or any child you know may be having. You can understand those persistent patterns of inattention, right? They're not listening, they're not following through with tasks, they're not tending to what they need to be, they're often distracted, they can't carry through with more than one instruction, or you got the inattention and impulsivity. I'm sorry, the hyperactivity or impulsivity. That's when you got the, what they call bouncing off the walls or can't sit still or the fidgeting or the other type of, even with the impulsivity, can be in their decision making or a child's. And when we talk about child, I want to make it clear that I distinguish, and what we're really focusing on is the age group of 12 and under. And so when you talk about impulsivity, you're talking about a child who can have anything from emotional type of impulsivity or decision making or just random, wild. Here we go. This is, I can't even believe the energy and what's happening in the frenetic behavior. But yeah, we're talking about all that stuff that you're experiencing that you've seen. So when it comes to things like that, the DSM indicates, yeah, we're talking about inattention or hyperactivity, impulsivity, but the narrative says that this is all under the umbrella of the brain. That is not what the DSM is indicating here. It's just talking about the behavior, basically. All right. Where are we going to go? Okay. So going on with the criteria, there's a lot to talk about here. But to be able to boil it down, I want to indicate some key things. First of all, there's the list of symptoms that have to do with ADHD. We're going to go beyond that because beyond the first list of symptoms, which we, there's several other criteria for even a child to be diagnosed with ADHD. For example, several inattentive or hyperactive symptoms were present prior to age 12 years old. Uh, Several inattentive or hyperactive impulsive symptoms are present in two or more settings. Example given: home, school, work, with friends or relatives, or in other activities. And basically, the symptoms do not occur exclusively during the course of schizophrenia or another psychotic disorder. And I know that can be a little heavy, but here's what I'm getting to, this second part of this statement: and are not better explained by another mental disorder. Example given: mood disorder, anxiety disorder, dissociative disorder, personality disorder, substance intoxication, or withdrawal. Why is that important? Because the DSM is going to discuss disorders, but the main context here in the DSM in this last statement is that basically it's indicating that a child can have every one of the total of 18 symptoms listed in the DSM. There are 18 symptoms under under ADHD and the different categories, which are ADHD predominantly inattentive type, ADHD hyperactive impulsive type, and ADHD combined type. So there are 18 symptoms that are listed. And the DSM indicates that if they meet the criteria, they could receive a diagnosis for ADHD. But even then, the DSM is also indicating that a child can have all the symptoms, every single symptom, all 18 of them, and a diagnosis for ADHD still not be appropriate because there are several other conditions that must be met for a diagnosis of ADHD to be even given. One, they have to have these symptoms in more than one setting. And I know you often see children and have them have these symptoms, in more than one setting, but there needs to be and supposed to be great discernment here of the symptomology, because for all children, it doesn't happen in more than one setting, not really. Or, for example, you find a child that is having tremendous trouble at home with a parent or parents, which is very common, but then they may go to practice and with their coach, another person in authority, they don't have any of these problems. Now, the DSM is trying to indicate that we have to pay great attention when a child is in a similar situation in life, but they're not displaying the symptomology the same. The DSM is indicating that further that they can have all the symptoms, but there could be other reasons, including when you look at the overall criteria, and there's so much more here. We're just scratching the surface that the symptomology could be reflected of what's the word? Uh, let me find it because I want to find the accurate words here. So bear with me for a second. Okay, the DSM says that all these symptoms have to be inconsistent or excessive for age or developmental level. This is not meant to be based on our experiences as parents or teachers or in the world. This is meant to be based on a foundational depth of understanding of children from a developmental perspective, which is not talked about, thrown out the window, not considered. I'm telling you, people, that we're not looking at children. We're not taught about it from a medical perspective. This is neglected from the standpoint of professionals and our work to understand children from a developmental perspective. But the DSM indicates that we are to discern, we medical professionals are to discern any of these symptoms or all of them from what is inconsistent or excessive for age or developmental level of that particular child. And this is where we miss the boat. We're often taking symptoms and being able to say, okay, because we see this kid running around like the Tasmanian devil or having these academic struggles or not listening or not focusing or out there in the baseball field and they're looking at the butterflies. We see these things, we go ADHD, ADHD, ADHD. But the DSM indicates there's so much more to that because you have to take the totality of the criteria to even be able to give a diagnosis. And the DSM has several indicators that go far beyond symptoms, including be able to say this could be normative, not successful, not acceptable, not we hope for, but this could be normative behavior. Believe it or not. And I've heard parents say, well, my child banging their head on the floor, having screaming outbursts, or these different things. There's no way, AJ, this can be normative behavior for a child. But another part of accurate information, because I have been given the privilege to understand children deeply, is that it often is that these unexplainable, seemingly uncontrollable outbursts, instances from your child, despite the fact that they might cry afterward and say, I can't help it. And we want to really be able to understand what that means. For a child, when they say they can't help it, they're not indicating that they can't control it. Or even when they say they can't control it, or they indicate heartbreaking things like that, they're not talking about it from a standpoint of inability or incapacity or divergence from the opportunity or the ability to do that. That's not what they're saying. What the children are communicating is, I don't have the strength often in times when I feel emotional or when the impulses hit me. I don't have the strength yet to not give in to that, to not let that kind of take hold and for me to operate or act on that. And the key difference is they have the ability, but not the strength. And the strength comes from accurate information, putting together a plan, and empowering them to develop the character muscles necessary. Yes, character muscles. Yes, your children have undeveloped muscles in their being that allows them to be able to not bang their head, not run around, not to focus, to listen, to follow through with tasks. They have the muscles, but those muscles are atrophying because we don't are not equipped. We as parents are not, or caregivers, or even professionals trying to work with kids are not equipped with the accurate information, and then the plan, and then the ability to empower them to grow those muscles to overcome these challenges. And many of you may say, well, here's the point where, okay, I've gone on, AJ, I've listened to you ramble, but here's the point now where I'm just gonna bow out. Thank you, AJ, for your time, but it's time for me to check out because you don't know my child and you don't know the children that I work with, and you may not understand that these children are not capable because they have a condition or a disorder that prevents them. And I'm here to tell you that in that it is much more likely that that is not accurate than it is. It is much more likely that regardless of what you've seen, been told, that your child has been diagnosed with, or believe, that it is much more accurate that your child does have the ability to overcome these challenges without psychotropic drugs, but with true empowerment. And that's the whole point of this, to understand that the DSM actually is more of a book of hope than anything. Because as we study it, which the DSM is often referenced, but as it is studied, which I believe most professionals don't do, and I'm just being frank here, and I may be saying things, and it's not to disparage the fact that professionals are professionals and they care. It's just to be able to highlight that in our medical society, study, believe it or not, I'm just being real with you. Studying the DSM is not encouraged. It's not. You would think it is, and it's said to be, but at the heart of medical practice, studying the DSM is not encouraged. How do we know? Because whenever I get with other professionals, such as the ones, part of my opportunity in Arkansas is to be able to supervise new counselors. New counselors have to be under supervision for usually a number of years. When to just to, the board wants to make sure that they're practicing, within, uh, ethical and healthy standards, right? It's just kind of a part of checks and balances of the realization that we as mental health or medical professionals really have a great responsibility to those we serve. And in that, I get to supervise new counselors and all. And I'll say all. I know that can be a kind of an all-encompassing word, but I mean, well, you get what I'm saying. I'm trying to say that, um, I'll just say it like this. I have yet to encounter one counselor, despite all their education and training, that had a process that empowered them, directed them to study the DSM, not just reference it. So when counselors are often going with criteria, it's not based on being able to discern or fully understand that the criteria goes beyond the symptomology. As example, in ADHD, the symptomology, all 18 symptoms a child can have. And then what's not discussed is the subcategories that the DSM indicates, but hey, you can't stop there. That the child has to have other things going on before the age of 12. They have to have several symptoms, more than one context. And I know these things can seem like, well, pretty much every child diagnosed with ADHD has this, but there's so much more to it, that it can't be explained by another disorder. The DSM is trying to tell us that, hey, there could be other things going on. And circling back to earlier in this video, part of that is recognizing that that doesn't indicate something going on with the brain or chemical imbalances, because that does not, most of the time, regardless of disorder, come from the DSM. That concept of the brain or chemical imbalances, when connected with most disorders, is from popular belief. not what the DSM communicates. I know we can talk about things like major depressive disorder. The DSM has indications in the actual writings that can help us to understand that the concept of it being a chemical imbalance that doesn't come from the DSM. The foundation of that doesn't come from the DSM. So where does it come from? I'm trying to indicate this because I'm we want to break the shackle of the idea that one way or another it all relates to some kind of chemical imbalance or neurological condition or even divergence that is just there. Because where does that come from? Most often doesn't come from the DSM. So when we're looking at things accurately, we want to use this not to create confusion, but to lay a foundation for a shift in our ability to open our minds to the possibilities and the transformative effects of accuracy so that we can break free from the things that are keeping us shackled that might be popular, might be comfortable, might be something that we're seeing and just kind of makes sense, but it's not actually based on wisdom. So, with your own wisdom, I'm just asking you, what have you heard? What challenges you? What gives you pause? What have you heard that actually maybe has ignited something in you? Maybe a curiosity, maybe something that says, AJ, I've had, I don't know, some thoughts or ideas, but this is maybe bringing to life some things that I've wondered. So we're here to recognize, to pull off the sheath, the cover, the hood of popularity and unlock you, your own understandings, your foundational wisdom, and your abilities, because the narrative doesn't do that. But you're here, we're here together for this reason. So we've had a chance to be able to look at ADHD from the DSM, and we're going to have the next video is going to have part 3, and that likely is going to be the final part. And I hope you'll continue to stay tuned because we're going to get into what the DSM indicates about genetics under the category of ADHD. And the DSM also speaks to brain scans, or somewhere popular. Some people are using different types of neuroimaging or brain scans or different things when it comes to ADHD. The DSM speaks about that. What does the DSM, the Diagnostic and Statistical Manual of Mental Disorders, the what is the DSM from the American Psychiatric Association? Yes, I was looking at my DSM. I got my cover all ruffled here, but that's okay. We can be a little bit ruffled, right? If you're a parent raising a child that has ADHD symptoms, you know what being ruffled is. But we can look at, and we're going to look at what the DSM shares about genetics, what it shares about neuroimaging or brain scans, because we want to look at it from an accurate perspective. I hope you'll find the information interesting. I'm glad that you're here with me. And as we do this, I hope that you can see my passion and just forgive any of the inconsistencies or challenges, or sometimes I may present something and may not be fully clear, but you can ask questions in below. Feel free to ask a question, but understand that a lot of the time the questions, one, we're not here really for challenge. And I say that not because I'm not asking you to challenge what I'm saying, but if it comes from a perspective of everything you've heard and the communication is based on that, and trying to sort of blast, and that's not going to be helpful. What can be helpful is for us to have discussions, or for you to ask questions that can prompt understanding with an open mindedness, an ability for me, hopefully, to be able to share with you sources of information that might be enlightening. We are together in a productive process of not trying to get likes or clicks or controversy. We're here because your child, a child, those children matter. That's why we're here. The only reason. You matter. Thank you for being here today. I'm excited to be on this journey with you. I hope you will continue to journey with me as we look to empower children overcoming ADHD. That's what we're about. Let me read this medical disclaimer before we get out of here. The video content is for informational purposes and not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have. And that's why we were talking about earlier when it says qualified health provider. Find those who really understand children, not just those who have a fancy license or a full practice or is very popular. The video, going back to the disclaimer, the video creator is not responsible for any loss or damage resulting from the use of the information. Never disregard professional medical advice or delay in seeking it because of something you have heard or seen in this video podcast or video. Thank you so much for being here. Thanks for allowing me to stumble. Well, we can stumble together and find truth. We are signing out for today, but stay tuned, stay connected, stay involved as we help you get accurate information, help you put together your plan, help you to empower your child or children to be able to overcome ADHD. Take care.